This is going to be very difficult for me, but I can't remain silent anymore. I'm not exactly sure how to tell my story. I'm scared to tell my story. This happened over 10 years ago. I have never been able to get help. My statute of limitations are up. I don't have any proof, as they like to say, about what happened except my truth and what I know and what I went through. And the rest is hearsay. It's emotional, it's traumatic, but I'm tired of being silent. I don't know what to do. I don't know if there's anything that can be done, but I'm really tired of this man, this monster, getting away with what he's done. I was diagnosed with endometriosis in about 2001. I had a few surgeries. Nothing worked. So I ended up having a total hysterectomy. I was told that would cure me. This was in a different state. I don't even know if I should say what state these things happened in. So I made a very difficult decision, but I was very sick. I was in a lot of pain. I had been through a lot of loss, grief, trauma. In my short life, I was 24 years old. I just graduated from college. It was my second degree. And 2 weeks after I graduated, I went in for my total hysterectomy. Fast forward to a year later in a different state, and the pain came back, the symptoms came back, and I was terrified. I was devastated. I went to doctor after doctor, and they told me it's impossible. Your endometriosis can't come back. You're crazy. It's something else. One even called me a purple spotted giraffe. Do you ever see a purple spotted giraffe in the wild? No? Well, there's your answer. I kept desperately searching for someone to listen to me. My father got a recommendation from a friend at work about this man, this butcher, this OBGYN specialist. And when I went to see him, he told me, yeah, it is possible. Yeah, you do have it, and you need surgery. And I'm thinking, hallelujah, someone's listening to me. I didn't want to have surgery. That would have been my fifth one. But I tried everything, and I wanted my life back. I was in so much pain. And so it started. That's when it started. I asked a lot of questions. One of the biggest questions I asked, and I will never forget it, was how many patients do you have that you have to do repeat surgeries on? if you do this surgery. I don't want to have any more surgeries. I've already had, 3 plus the total hysterectomy. And now we're talking about a 5th one. And he held up his hand and he said less than, whatever fingers he was holding up, 4 or whatever. He lied to me. But I believed him. And I had surgery. And a lot of this is, this was 2003 to 2005. Or no, 2003 to 2005. My memory's bad. So in 2003, it starts running together. Because, I had the surgery. And you have the surgery and you feel better. And you think, oh, finally, I'm cured. And, because, he explained the surgery in terms of me being a piece of meat. And he literally used the word fillet. I'll never forget it. And he said, because I asked so many questions. And I had printouts. I did research. This was 2003. But I asked questions and he lied to me. And, what about scar tissue? What about, the adverse effects? But he said, that it's like a piece of steak. And you cut it all. Like fat off of a piece of steak. And you fillet it. And you just cut it all out. And if you cut deep enough and you cut everywhere, then it can't come back. And as much as I didn't want to have it done, it made sense. And he's a specialist. He's the doctor. He's got the degrees on the wall. And, he played the fatherly, kind, caring man to the hilt. He really did. He was a con artist. And, so, okay, have the surgery. Fillet me. Oh, well, while we're in there, we might as well take your disposable organs. And I see you still have your appendix. So, we'll just take that out while we're in there. And I'm thinking, okay, I've had trouble with my gallbladder. I had that taken out when I was 16 years old. I had all of my reproductive organs removed. My cervix was removed. Everything was taken. So what's an appendix? So, I did that, and I had the surgery and he felt okay for a while, and, you see him, and I saw him every week. And I trusted him. He was like family. I trusted him, and he gave me every hormone in the world. And I kept hearing, estrogens and hormones, they make the endometriosis grow. And I'm thinking to myself, well, this doesn't make any sense. Why am I being given hormone replacement therapy at 25 years old, when I'm being told that it will cause the endometriosis to grow, even though I've been told that the hysterectomy would cure it. None of it made sense. None of it made sense. And, you know, you're given every drug in the world. You're given pain medicine because you're miserable. And you can't think straight. You're sick. And you believe the doctor. You believe the surgeon, especially, you know, his demeanor and the way that he acted and his caring manner and all. It was just all lies. You know, and I had procedures, I had treatments. I don't know what all I had. I had so much stuff done. Well, it's not working. It's not working. I'm gonna have to have surgery again. You know, 6 months down the road or whatever. And I start asking the questions again because I don't want to have surgery again. You know, what about scar tissue? You know, the adhesions. Doesn't that cause problems? You know, we're talking about a 6th surgery here. And he just said, that won't be a problem. I'll just, you know, destroy them with the laser. You know, we'll go in with the same incision in your belly button. You know, routine. You know, just sign the forms. I'll make you better. What happened to that, you know, 4 patients line he gave me? So I did it. And I had the surgery again. You know, and it became a pattern until it just blurs. Now the pain's back. It's time to do surgery again. That's what he literally said. It's time to do surgery again. And I was scared. I was miserable. I was in pain. I was young. I didn't know. I'm the type of person that doesn't like confrontation. So I didn't push back. I asked my questions. I tried every other options, you know, nerve blocks and everything I could, and nothing worked. And the time span just kept getting shorter and shorter, and no, you gotta have surgery again, and you gotta have surgery again, and you gotta have surgery again. And I'd have these surgeries. I would be so terrified. They would have to give me drugs to calm me down because I was like a cat at the vet. I just didn't want to be there. I was terrified. I started praying that I wouldn't wake up from the surgeries anymore. I signed an NDR because I didn't want to be woken up because I was so miserable. I had to stop. I lost my train of thought. This is really hard. It's very traumatic. The story isn't even over. It's never been over for me. since I met that criminal. But, I kept going, and I think about that girl who was so desperate to get better, who was in so much pain, who was so helpless and scared, but determined to get her life back, to be cured, to look at this person as kind of a savior, because that's how he portrayed himself. Only I can fix you. Only I understand. Only I care. Because I found this out later, but that's a different part of the story. Every time I had surgery, and I would be home after surgery, he called me from home. How are you doing? How are you feeling? How's my patient? How's my girl? Are you okay? Do you need anything? The surgery went really well. We got it all. And I just thought, wow, he really cares. It was all part of the con. But you think, how many doctors take time to think about their patient, let alone call them and ask them how they're doing, right? Apparently, I wasn't the only one who thought so. But I didn't find that out until, over 10 years later. So, I kept seeing him. He was about the only doctor that I saw. I saw him all the time. And I just became more and more disabled. I couldn't function. I was in pain all the time. And, he was right there with that paper. That surgical paper. There was this one time I was in his office and I looked at that consent form for surgery. And I found a typo because I'd seen it so many times that I knew every word on that page. And he's like, oh yeah, you're right. That's how many times I had surgery. And he's still doing treatments, and he's still giving me pills, and he's still doing this, and he's still doing that. But in the end, it always comes back to the surgery. It always came back to the surgery. And as I said, the time span just kept getting shorter and shorter. And I, 6 months became 3 months, became, 1 month. I didn't even have time to heal before he cut me open again. I dreaded my post-operative visit because I would hear those words. I would hear, you have to have surgery again. Nothing we can do about it. You're just one of those rare cases. You're really, really bad. And I had the surgery. And like I said, I don't even know how many I had. I don't have my records. I couldn't get them from that man. I've never been able to get those records. But as I learned much, much later, it wouldn't have mattered anyway because he doctored them and he did so many unethical things. He lied in the reports. He covered his ass. And, so, a year, 2 goes by. And we're in the double digits now with surgeries. And, I never got to work. I never got out of the situation. I never became independent. So I was on my parents' insurance. So I don't know anything, really. I don't have any information about how many surgeries, how many treatments, how many procedures. I don't know. I know it was a lot. I know it was too many. I would say somewhere between 10 and 15 in the span of 2 years. Maybe more. I don't know what he did to me. How many times did I sign the paper? That would be a good indication, right? Or did he destroy that too? So there was this is so traumatic. There's this one procedure he did in the office. And I still have flashbacks. Every time I'm in a stirrups or an operating, office table, needles, all of it. I don't know offhand what it was called. It was torture, is what it was. I've been sexually abused and assaulted in my life. And I have a hard time with men in general, with pelvic exams, all of it. I have a condition called vaginismus. It's a way of your body's protecting itself. So I was told that I needed to have this type of nerve block where he would take an epidural needle, not any small needle, a very, very large needle. And he would need to go in and inject my pelvic area through a pelvic exam, find out the painful places, and inject me with the numbing agent. And then that would help me. So I go into the room, and there's a nurse, and there's him, and there's the table, and you get the stirrups and everything, and you see the needle. They don't even hide it. You see it laying there right next to you. They don't give you any drugs of any kind to calm you down. They don't give you any pain medication. They don't give you anything. They don't even warn you. And, the pelvic exam is painful enough. And that's how they found endometriosis in the first place, because I went in for a normal pelvic exam in 2000 and I screamed, and it was excruciating. And they said that wasn't normal. And ever since that, it was painful. So here he is, giving me this pelvic exam with the nurse in the room and this needle laying right there like a dentist's office. And he took that needle and he stuck it inside of me. And I'm terrified. I'm absolutely terrified. And I'm screaming. And then, just when I think it can't get worse, then he starts jabbing me with that needle. Over and over again. In the worst places, in the most painful places. And he's smiling. He's enjoying himself. He doesn't care that I'm crying and I'm scared and I'm hurting. He doesn't stop. This man enjoyed it. So, finally is finished with the procedure, and I was in so much pain. I was so traumatized. His office was about an hour away. I was in so much pain in the back of the car. Every bump, every movement, everything. I was in the fetal position. I was in so much pain. I was so traumatized. No amount of pain medication, no amount of anything could ever help me after that moment. And it didn't work. It was worse. And I went in there. And I told him that I was still in a lot of pain. And he just said, we'll have to do it again. Like it was nothing. And I refused. I couldn't do it again. So then your only other option is surgery. Well, if we can't, numb your pelvic area internally, vaginally, whatever you want to call it, then we're going to have to go in and do surgery again. So I did. And each time, it took longer and longer for me to heal. And like I said, I didn't even get to heal this time because, let me tell you, my 2-week post-op, I went in there and I was in pain. And that man told me, well, this just isn't working. So we're going to have to cut you from your sternum all the way to your pelvic bone. And we're going to have to open you up completely. And we're going to have to clean out everything because clearly we're not getting all of it. My 2-week post-op. And that's when I snapped. And I said, no. You will never get my consent for this. You will never touch me again. You will never get my consent. I will never sign another one of those pieces of paper. And I walked out and I never came back. But the damage was done. The damage was done. And I have to backtrack because I forgot this part. Somewhere in between all of this, these surgeries before I left. Now this man had a few offices. They weren't normal offices, let me tell you something. They had valet parking. They had refrigerators with bottled water in the waiting room. He had his own spa. And I jokingly at the time said that my body was paying for that. And I didn't know how right I was. So I needed to go to a pain clinic. So he referred me to a pain clinic. His good buddy. And I went to the pain clinic, and it was pretty much just a medical drug distribution center. And I had nerve blocks and every pain medicine in the world, But the key point to this part of the story is that in 2013, my pain doctor was accused and indicted on 29 counts of sexual misconduct, rape, and other sex crimes against his patients and his staff. I saw that on the news. And I was re-victimized all over again. Because I was under anesthesia with that man. You can't get more helpless than that. And I thought, what did he do to me while I was under anesthesia? If he brazenly assaulted his patients in the exam room while they were awake, he also did the same thing to people under anesthesia with the nurses present. And he attacked his own nurses and his own staff. What did he do to me? I'll never know. I read an article where a husband was in the room with his wife while she was having a nerve block and she was under anesthesia. And there was a curtain, but the husband could see through the crack, and he saw the man assault his wife. The pain doctor assaulted his wife. And he was in the room. This is a man that was actually went on trial. The police actually got him for all the good it did. You know, he was indicted on 29 counts. Almost 100 women came forward. They found emails of reports to his partner from staff reporting these incidents, and they were covered up. The rape crisis center was flooded with calls about this doctor, this buddy of the butcher. 2 peas in a pod. And they only got 29 charges. He indicted him on 29 charges. Only one stuck. And that was the rape against his own nurse. He's appealing that. His license is suspended. So that's how great my state is. That's how great my state is. And that's how great my county is. My area that I live in. That's how wonderful the justice system is. Well, I mean, that's why I'm telling this story, right? For the people who are listening. You know what kind of justice we get. And he's probably gonna win. There's a statute of limitations on victims. I can't have a malpractice suit against my butcher. I can't come forward with the things that I know and be properly, file charges against my butcher. The things that he's done to me and so many other women. There's no representation for me because my time is up. During that time, I was traumatized, I was in pain, I was sick, and I was scared to death of even going anywhere near a doctor. So how was I supposed to turn around and find a lawyer at the mind frame and the strength and everything to go through a trial? Even if I thought of it at the time, a year to 2 years after this happened. Just the pain medicine alone, you can't even walk across the floor in a straight line. If anybody would even take my case, say I did do anything in that window because of the statute of limitations. I still didn't have any proof. When I finally got the strength to go to another doctor that was friends, personal friends with my primary care doctor that I'd known since I was a kid. Because I have interstitial cystitis, painful bladder syndrome. I have a lot of health problems. I'm disabled. How could I not be? So she recommended the urogynecologist, and I didn't want to see a male urogynecologist, and obviously I didn't want to do any of that stuff. But I went to that doctor. I lost my train of thought. Oh. So I went to the butcher's office to get my records. And I paid for my copies. And I waited. And I got a real attitude, from the staff. And I only got a few pages. And I was studying medical transcription at the time, online. So I knew a little bit. It didn't take much to know that this man had completely... Where's the rest of the reports? I've had double-digit surgeries, and I only have half of a surgical report. Where I saw him for 2 years. Where are all the office visits? Where are all the surgical report? Where are the pictures? Where is all this stuff? Because he showed me pictures when I was in the office. He showed my family pictures when he would come into the waiting room and act like he was God and be like, I saved her again. Look how bad she is. Where was that stuff? So I looked at the surgical report and there was just nothing there. And I looked at the office report and the office visit notes, and it was so insulting. The man said that he advised against surgery, but the patient insisted. I don't even know what to say about that. Because clearly he lied. Clearly he lied in the reports. Clearly he was hiding something. Clearly I didn't get everything. And I paid for those supposed records. And I realized I wasn't going to get my records. I wasn't going to get the truth. I wasn't going to get what you normally see in a surgical report and office visits. I saw that he had skewed it to make him look like he'd done nothing wrong. And, so, this is like, I don't know, maybe 2006 to 2008, something along those lines. And I'm seeing the urogynecologist, and he doesn't have my records either. But I told him what I knew. The best that I knew from what I'd been through. And I told him about all the surgeries. And I remember he said, there was no reason for you to have that many surgeries. He said, even if you had radical cancer, you shouldn't have had that many surgeries. And I just, you're just in shock. You know, but you don't know. I don't know. So, I moved, to another state again. And tried to get my life back. And I would try to work when I could. I never could work even a year. My entire life, I've never been able to work longer than a year. My health just always defeats me, and I have to quit. So I moved back to the state where the butcher was in. This is my hometown. That's why I keep going back to this state, unfortunately. And I started having problems with my bladder really bad. I had kind of gone into remission from interstitial cystitis and my painful bladder syndrome, but it came back with a vengeance when I moved back home. And from what I understand now, extreme stress can do that to you, and I was under extreme stress. And I also had a really, really horrible bladder infection that I needed to go to the emergency room for. So I came out of remission, and I had to go back and see the original UroGYN. And So this was around 2014, 2015. And he knew me from, before. It'd been a while since I'd seen him. And I started having bladder treatments and all this other stuff. And, just always had pelvic pain. How could I not? But, I wouldn't have surgery anymore. And, I was surgically menopausal. I was in my 30s now, my mid-30s. And, I had to be the bladder. Had to be the bladder. Don't know what's going on inside of me. Never did. Endometriosis or anything else. Obviously, I never talked about endometriosis again. I just dealt with the pain. I just dealt with the pelvic pain. I just dealt with the damage. I just dealt with it. Because I wasn't going to ever have surgery again. I was never going to have the treatments again. I was never going to do any of that stuff again, ever. But I was being treated for my interstitial cystitis. And I don't know how this came about. I was filing for disability at the time. Maybe that was part of it. But this is the key hearsay part of my story. She was in the office, and I'd had, my bladder treatment, and we were talking about my disability, and we were talking about, my history. And we started talking about the butcher. And my Uro-GYN was really getting angry. And he started talking about him. And I'm sitting there in the office. And he starts telling me all this stuff about the butcher. And the thing that struck me was that my doctor was saying practically verbatim what I had only heard when I was alone with the butcher in his office. And also things like calling after surgery. So also his manner, what he said and what he did. And I just thought, how does he know that? Because I thought I was the only one. And that's when it hit me. And I believe I even asked that question. And that's when my Uro-GYN said that he had some of the butcher's former patients. They were now his patients. And he'd heard the story over and over and over again. And that he did that to all of us. And I'm in shock. And he continues to talk. And the door's open in the office, in the exam room that I was in. And he's talking, And he starts telling me things about the butcher that only a doctor would know. And he said that the butcher would swap surgical pictures that were worse to make us think and our family think that we were worse than we were. That he committed insurance fraud by saying that he did robotic surgery on us when he never did. That he kept us in the recovery room for hours, making our family believe that we were so bad that it took longer than the expected time to have the surgery. And then he would come in and be the savior. Oh, she was really bad, and, but I saved her. I saved her again, and, and it drew our families in, and they trusted him like I did, and like the other patients did, because of the con. Because he did this over and over again to God knows how many patients. So again, that lie with, 4 fingers up in the air, I can count on less than one hand how many need more than one surgery. And he said, in all honesty, the surgery was like an hour. But he kept us there longer to make it seem more severe, to keep that con going, to make our families believe that this man is working to save our loved one. Just the sickest. It's like it's out of a movie or a fiction novel. And I'm probably forgetting some things that he told me, because at this point I'm crying hysterically. And I'm in shock, I'm traumatized, I'm shaking. And I said, why? Why did he do this? He ruined my life. He ruined my body. I can't do anything. I can't work. I'm broke. I have chronic pain every day. Why? Why did he do this? And he said, money. He did it for the money. I can't even begin to explain.